going, keep going, keep going, keep going.
I'm glad you guys are here. They're starting.
5 women are at the threshold of birth.
How are we doing here?
A moment defined by both profound joy
We're about to have a baby.
And push.
and incredible pain.
It hurts a lot. We gotta get him out.
In the hours ahead, they will confront the best and worst that new life has to offer.
We'll basically do the same thing we always do, stabilize her if we need to.
As each of their babies takes its first breath.
Oh my goodness.
Glenette Scott's baby is preterm. Only 36 weeks. But she has to deliver early. Her baby is in danger.
Okay, you have a contraction right now. Take a nice, relaxing breath.
Glenette's baby has a rare physical defect,
And push down. 1, 2, 3,
a condition called gastroschisis,
7, 8, 9, 10. Blow it out.
which means her baby's intestines are outside its body.
Gastroschisis is a descriptive term from a Greek word, basically means split belly.
9, 10. Blow it out. Deep breath in again. And hold it. 1, 2, 3.
And what happens is that a part of the abdominal wall doesn't form and it leaves an opening that the baby's intestines and liver and whatever else is inside the belly can come out.
And bear down hard. 2, 3, 4.
So it's not contained while the baby's in the womb.
Glenette will deliver her baby at the National Naval Medical Center in Bethesda, Maryland. It is the military's top hospital for high-risk pregnancies. Glenette's husband, Corey, is a corporal in the Marine Corps. 12 hours ago, they got more bad news when an ultrasound turned up other signs of trouble.
This infant had a dilated stomach, as well as other loops of bowel that were noted to be dilated on the ultrasound today. That could possibly indicate what's called an ileus, which would be a partial bowel obstruction for the infant itself, and that would indicate need for delivery early. And so that's what we're going to do today.
Come on, keep going, keep going, keep going, keep going.
After delivery, the gastroschisis could be fatal. Surgery for this baby will be a matter of survival.
This pregnancy has just been one I'll never forget. Of course, you can't really forget any, but this is so special.
Alicia Bowers has been walking the halls of the Naval Medical Center for hours, hoping exercise will jumpstart her labor.
And I've been here Saturday since like 3 o'clock, and it's 10 o'clock Monday night, walking the halls. Okay, the hospital's nice, but it is not that nice to where I want to see it every day for 2 weeks.
Or hiding in the corner somewhere, in a belly which has no corners.
Alicia is already the mother of 3 and is now 36 weeks pregnant with twins.
She doesn't like this.
No.
Can they hear it?
They don't hear it as much as they can feel us pressing on them, so they think we're like playing, like, hello, hello. So we press on them and they press on us.
Oh.
They think it's a game.
Being pregnant with twins is amazing. The kicking and everything is different.
You know, the rest of the world can't.
She's been having stop and start contractions for several days.
When you go through them, you're like, okay, this is all worth something. This is what it's doing.
Blood flow.
But then when they stop and then you realize that it's done nothing, you haven't dilated anymore, it gets really frustrating, like you went through the pain for nothing. You need to behave. And you can tell that sometimes like they're fighting or they're playing with each other. It's just really cool. They're both grounded.
Literally.
Yeah, I've already decided when they come out, they're grounded.
Alicia is hoping to deliver today, but she's facing 2 problems. For the past few days, the babies have been doing somersaults.
The biggest part of the baby is the baby's head. So if that's the last part to come out, you're not quite sure it fits. So if the head comes out first, you're pretty sure everything else is going to fit.
If you're fixing to induce and then you do the sonogram and Ashley decides to come put her bottom down.
If she decides to put her bottom down, you would probably have a C-section.
Okay. The nurse said that they were fighting to be the first one out, so that was really cool that they turned, and right now I don't have to have a C-section, so that's really cool.
I think Dr. Heller had mentioned to her about the baby bleeding.
But there's a more urgent concern.
I'm glad you guys are here. They're starting.
The twins' lungs might not be adequately developed. Delivering them too soon could be dangerous.
I mean, her head's not up here. She may not be vertex, but her head's not up.
To test her baby's lungs, Alicia will have to undergo an amniocentesis, but it could put her into labor instantly.
Great.
Push. Don't blow, just push. Excellent. Let it out and reload. And big push.
In another part of the hospital, Julie Trainor's second baby is a week late and low on amniotic fluid.
Big push.
Low fluid can reduce the baby's oxygen supply.
And they fear that with the contraction, along with the lack of fluid, that the baby will start to go into some distress for heart rate and things like that.
The Naval Medical Center cares for the President, Vice President, their families, members of Congress, and the justices of the Supreme Court. And each year, doctors here deliver more than 2,000 babies.
1, 2, 3, 4.
For both Julie and her husband, Monty Hassenbank, the birth of their second child is a true affirmation of life. On September 11th, Julie and Monty were at work at the Pentagon.
We kind of were talking in the office about, the attacks and where they were going. And literally, just 3 minutes later, a big boom, the whole building shook, and we looked out the window and just saw flames.
The first thought that went through my mind was, how did someone get a bomb into the Pentagon?
And the first thing he said to me was, Julie Gray, our son, is at the Pentagon daycare.
They were 5 floors up, and Julie was 4 months pregnant.
That was our main concern, is getting down to the daycare for our son.
We were lucky enough to get out when the lights were on and, through a quarter, so it had to have been incredibly frightening for some of the unfortunate people who had those conditions with, with the chaos surrounding them.
All right. Well, I'm going to step out.
Okay.
I don't expect it'll be too much longer.
Okay.
I'm going to have Lieutenant Massengill
Okay.
go ahead and push with it. He's one of our aspiring residents.
Okay, great.
On September 11th, Julie and Monty came terrifyingly close to losing their family.
No sweat.
Now they're about to add new life. Christina and David L. Sesser are about to relive the worst day of their lives.
My last pregnancy, we thought we were going to the hospital to have a baby. When we got to the hospital, they immediately couldn't find a heartbeat. My baby died. It was devastating. I was just in shock. We couldn't believe it. I just want this to be really sterile.
It will be, okay?
Cold and scratchy. Most people have never had to deal with this, where they have to relive an experience as traumatic as delivering a child that either dies immediately after delivery, or in her case, it comes in stillborn. So we'll come into here. It's a decent pocket, okay?
Oh, I guess I'll be able to see the needle going in on that screen,
Yep.
huh? Okay, I'm just gonna watch that. Okay, now I'm getting nervous. We did an autopsy on the baby. They were never able to determine why the baby died.
You're gonna feel poke?
That means whatever caused the stillbirth of their last baby could cause the death of this one, too.
We're in. Just take a few more seconds.
Are you pulling fluid out right now?
I sure am.
Whatever went wrong between 37 and 39 weeks. Once I hit 37 weeks, which is today, I feel like I'm in the danger zone where we don't know what's gonna go wrong.
We're coming out. 1, 2, 3, out.
Oh, that
right.
didn't hurt at all. You did a great job. After you lose a child, when you have that next child,
Okay, open wide and back to the camera.
is the biggest event of your life?
98.7, great.
Ow, jeez.
To start her labor, Christina's doctor administers Cytotec, a topical drug that will soften her cervix.
If the cervix isn't ripened or isn't ready to dilate, it really doesn't work.
Yeah, cervix is very soft. It's not open yet.
What? How much it faced?
Cervix is
100%?
thinned out. It's not 100%. No,
Okay.
it's more like 80. And then,
Okay.
so you're good to go.
After 3 doses of Cytotec, they start Christina on an IV of Pitocin, a synthetic hormone that stimulates labor.
But I don't want to hurt anything.
No, you'll be fine. Anybody's guess as to how long this is going to take. It can take 4 hours or it could take 24 hours.
I had my second dose of Cytotec, so now I'm having little wimpy contractions every 4 minutes, and they don't hurt at all. So I think things are moving along.
Just looking around for pockets of fluid here that we can get a sample of the baby's amniotic fluid to check for lung maturity. We want to look for a nice big pocket, but there's placenta there, so I'd prefer to not go through placenta.
To find out if her twin baby's lungs are mature enough to deliver, Dr. Steitley has to draw fluid from Alicia's amniotic sac and have it tested.
It's gonna feel like an IV, okay?
I'm nervous because if for some reason it accidentally busts the sac, then I'll have the babies immediately. That's the only thing I'm nervous about. And besides, it's just, you know, a big needle going in my stomach is kind of scary.
It's a big sting. Okay.
What did you think when you found out you had twins?
I didn't know what to think.
They're looking for certain lab values. Anything greater than 50 is good.
Okay, slow, deep breath. Look at me. Look at me.
If she were to rupture, if she were to actually go into labor, we'd know what procedures to look into because she's still preterm. And that way, we'd know what actions to take as far as neonatal intensive care and what kind of complications would develop as far as respiratory distress is concerned.
So there we are. Perfect, nice, clear fluid. Looks good.
Good. It was scary.
But test results on the amniotic fluid are inconclusive, prompting a second round of tests.
All this orangey stuff is going to wash right off.
Get you on the monitor now for a little while and just watch the babies. There, everyone see the face?
Look!
Hands up.
Oh, it's precious. Look at her.
If the second test also indicates that the baby's lungs aren't ready,
Ooh, yeah.
delivering them today will be too dangerous. Alicia will have no choice but to wait.
Oh, my stomach hurts.
Yeah, you're going to have some cramping just from irritation of the muscle of the uterus.
I guess I'm not on bed rest.
All right, pretty girl.
I think I'm just on hospital arrest.
One, two, three.
It.
Good job. Good. Keep going. Keep going.
It's shortly after 9 p.m.
Now, and push.
10 hours after Julie was given Pitocin. Her cervix is now fully dilated.
Good. 9, 10. Good job.
Just to be safe, Julie is on oxygen. Her contractions have been fast and intense, which could be restricting blood flow to the placenta, making it hard for the baby to breathe.
One more.
Here we go.
The baby is coming faster than anyone expected.
We're about to have a baby.
Yep, we're gonna have a baby here.
Pediatric doctors are being called because Julie's amniotic fluid contained meconium, a baby bowel movement.
If it gets inside the lungs, that's where you can have like really bad, bad outcomes with babies if you don't have the proper treatment.
How are we doing here?
Okay,
let's go ahead.
Okay, take a deep breath in.
Big push.
Push, baby. You're doing great. You're doing great.
That's it.
Doing awesome.
Julie started pushing at 8:46 p.m. In less than 30 minutes, she welcomed a new baby boy into the world.
Congratulations.
Great.
There goes the section. Congratulations.
Doctors clear the baby's airways to prevent the meconium from causing any respiratory problems.
Okay, do you want to cut the cord?
Yeah, put your foot too.
Hi. Hi, buddy. Congratulations. Hi, beautiful. Oh.
If we place the epidural too soon, the pelvic muscles relax, then babies are at a higher risk of getting just kind of soft in an inappropriate position in your pelvis.
Okay.
During the early months of her pregnancy, Nicole Trott thought she was losing her mind.
I was showing really big for my gestational age. I kept saying to the doctors, what is going on? Why am I so big? And they're like, oh, you're just big. Not a big deal.
Try to keep all those muscles nice and relaxed. All right, there we go.
So when they first diagnosed me with polyhydramnios and there was an actual reason that I was so big, it actually put my mind at ease to know that I wasn't just going crazy.
Oh, ew.
Was that it? Big gushing fluid.
Oh, that's very weird. Wow.
Big breath.
Polyhydramnios means the baby's amniotic sac holds too much water.
Nice clear fluid. Oh, that's very reassuring.
Without medical help, her baby could suffocate from lack of oxygen or strangle on its own umbilical cord.
I know. Well, that was interesting.
And with the pressures continuing to climb like this, I think that the smart thing to do would go ahead and start that medication.
Okay, is it possible if we could just hold off for one more BP and see if it...
I really wouldn't.
Nicole is a sergeant in the Army. Now 38 weeks into the pregnancy, she and her husband Paul have endured months of worry about their baby's condition.
I mean, I'm always like, were you all right? I mean, I know that she's pregnant. It's hard for her to get a bit, but I'm constantly, are you okay? Are you okay? Let me help you sit up. And I still like to try and help. It makes me feel like I'm doing something.
All of a sudden you're going from 2 to 3 and the stresses that it could put you through and all this stuff. We've discussed them, but we haven't dwelled on them. It definitely does put your relationship in a different place. But it's such a great place, you know, it really is.
Adding to the stress of her pregnancy, Nicole also suffers from preeclampsia, pregnancy-related high blood pressure and swelling.
And they decided that it would be best to induce the baby because there's more fluid around the baby today than there was on the 11th. Her blood pressures are higher today than have been in the past.
This is going to be a bolus of magnesium. You're going to feel kind of flushed when it goes in, like little hot flashes, and after about a half an hour it should subside.
I can do this.
You're doing great.
Let's have a baby.
Push hard.
Gwinnett is going to deliver her baby vaginally.
And blow it out.
Despite the fact the baby's intestines are growing outside its body.
All you've got, all you've got.
Study after study has shown that it's extremely safe, and we recommend that moms undergo a vaginal delivery, that there's no increased risk for the fetus or for the mother to undergo a vaginal delivery. As a matter of fact, with any kind of surgery, the mother's put at a higher risk for complications if she undergoes a cesarean section.
Here we go. Oh, here we go. Here we go. Here we go. Come on, Mom.
Come on, keep going, keep going, keep going, keep going.
Oh, God. Hey, sweetie. Is it a girl?
Yeah, we think so.
Oh.
5:59. I've got it pinched.
Right here, right here.
90% of the baby's bowels are outside her body, exposed to infection and dehydration now that she is outside her mother's womb.
Slow. Let's get the bag on so we can work.
About 10% of the babies born with this condition don't survive.
The big concern following the delivery is that children can lose a lot of water from having their intestines exposed to the open air. So we minimize its exposure to the open air by wrapping the contents basically in cellophane. Saran wrap, it acts as kind of a second skin to prevent the evaporation of fluid from the intestines.
How's her heart rate?
It's okay.
She's breathing, you guys. Cut her off a little bit. She's crying. She's fine. And we're going to put her into the warmer.
A pediatric team rushes baby Brianna to the neonatal intensive care unit. Without immediate care, she could die within hours.
How do you guys want to divide and conquer? One person to put an IV, one.
As soon as she's stable, they'll send her into surgery.
Excuse me.
Connor, the second son of Navy Lieutenants Julie Traynor and Monty Hassenbank, has made it into the world safe and sound.
Julie told me to go down and grab a sandwich, and I was gone like 25 minutes, and I came back up. There were doctors all around the bed, and I'm like, okay, I think I'm missing something.
I missed the first one.
You want to hold him again? All right, buddy.
Hey, pretty boy.
I'm not looking forward to this.
Okay, I'll grab my hand if you need to. Squeeze away if you.
You're still closed.
After 18 hours, Christina Elsesser still isn't in active labor. The drugs are working, but slower than she'd like.
Yeah, the cervix is very, very thin.
How could I still be closed?
Okay, and baby's head is getting well applied in the cervix, so that's going to start to help.
The baby's dropping down.
And getting well applied in the cervix, so we just need to
Keep doing what we're doing, and I'll
pushing
sit
along.
up and help you out. I've had really, really strong emotions today. I'm thinking about my baby that died, and I'm thinking about Davy, my baby that's coming on the way. And I've got all these hormones, and I'm in labor, and it's been very intense. It's the most intense emotional feelings I've ever experienced. So what do you recommend? Are you going to do an epidural or an epidural spinal? You're the boss, whatever you say.
Well, let me just get a couple things set up here. If you remember the cold soap from last time.
Even though she's dilating slowly, Christina is in intense pain. An epidural will help relieve the worst of it.
Stick and a burn. 1, 2, 3.
I think that she has kind of unrealistic expectations.
Where'd you feel that? Left, right, or in the middle?
I felt it to the left side.
Did you? Okay.
Oh, Jesus.
Hang on. Let me numb you up some more.
Because she does have a history of faster labors, and so she just assumed that this one was going to be just as fast.
You feel like a funny bone sensation down into one of your legs or hips. It'll go away really quick if it does.
Yeah, I feel it.
Good.
I'm strapped to a bed. I'm not allowed out of the bed. The anesthesia is making me itch all over. I can't take a shower. I haven't brushed my teeth. Ugh.
To speed Christina's labor, doctors decide to try to trick her cervix into fully dilating with a Foley bulb.
No, okay, don't get mad at me, but you've done hundreds of these Foley bulb things, right?
Yes.
Okay, I thought so. Okay, go for it.
We're taking a Foley bulb, which is normally a catheter that is used to drain the bladder. Sometimes you want to turn your head because these things will break. Squirt water all over the place. And we're placing that into the cervix. Then we're going to fill the balloon that would keep the catheter in the bladder. We're going to fill that balloon full of saline, salt water. Deflate it.
Oh, you're seeing some action in there, huh?
Yeah, we're seeing some good action. And what we hope to do is create a mechanical dilation of the cervix. Cool wet jelly part?
Christina's cervix is finally dilated.
See it holding this thing in place.
Well, this is good news, guys.
Definitely.
Gonna have a baby.
I don't want to push too hard. Should I start out with some gentle pushes?
We'll see how things go. I mean,
Because I think
can
I
tell you,
pushed too hard last time.
Finally, after 20 hours, Christina is in active labor.
I can't wait to see my son.
One, 2, 3.
Nicole has been pushing hard for several hours, but her baby is in the wrong position to deliver.
The baby has to be so far down and in some good positions for us to actually help you out with a forceps or a vacuum. And if we would need to assist to take the baby out, well, we would actually need to turn the baby with the forceps first. Because if forceps aren't successful, the next route of delivery is C-section.
I don't think that there's very much rotation that we need to do as far as turning baby. Okay. I think what we need to do is we need to help guide baby's head underneath the pubic bone.
Forceps.
And we'll need all of your help to help push baby down, because what the forceps will help us to do is it'll just help us to guide baby's head in the correct direction. But we still need your help to be able to pull baby down, to get baby down, okay?
A forceps delivery could injure Nicole's baby, cutting skin and causing bruising.
Okay, with this next contraction.
10, quick back. Come on, Nicole. Push.
Come on,
Push. Push. 2, 3, 4, 5, 6, 7.
Come on,
8,
come on, come on.
9. Come on, push.
Look at him.
Push down.
Oh, look. Oh my God. Cut the cord?
Yeah.
Okay. Right here.
Congratulations, Mommy did great.
Look at him. Thank you.
Beautiful. I have never felt better in my entire life. I can't even describe it. Oh.
Is there a special page in here, dude?
Yeah.
I don't know where it's at.
It's not going to be long.
In the neonatal intensive care unit,
You want to get blood work on this other side then?
a pediatric team works to stabilize Glennette's baby as quickly as possible. With the intestines outside her body, baby Brianna is at risk until surgery.
Did we call X-ray? Is X-ray coming? Yeah. We'll basically do the same thing we always do, stabilize her if we need to, by breathing for her, by giving her fluids, by giving her medicines, if she needs it, to keep her blood pressure up.
You need a neck roll?
We basically will do some blood work, start her on antibiotics to prevent the possibility of infection, because her abdominal cavity is out in the open air, and that puts her at risk for developing an infection.
And she was -7. Did you see the gas? Yeah.
So we give her narcotics like fentanyl, which is a fairly strong, short-acting narcotic, and then also benzodiazepines like Versed, things that make the brain sleepy. The fentanyl also helps with pain. So we also want to make sure we control her pain. Young babies feel pain just like older adults do.
We intubated. In other words, we put an endotracheal tube in her trachea, and right now I'm giving her positive pressure ventilation. So in other words, we're breathing for her. And the reason we did that was her own efforts at breathing were not that vigorous.
Before surgery, Glennette wants the chance to see her baby girl. Even though she can't hold her, she wants to be close to her.
Am I having a contraction?
It's not looking like it, but
Okay, because I was feeling better, and it's because I'm not having a contraction.
Christina Elsesser has waited for this moment for almost a year. She has been in labor for almost 48 hours and is now having rapid, intense contractions.
Yeah, I'm having one now. And I can feel all the pain. My epidural does not work. Ugh. Try not to tear, try not to do a episiotomy. I have 2 old tears, don't tear through them.
If I do, your bill is free. Go ahead and push down on top of me.
To help make her comfortable, Dr. Macedonia gives Christina another injection of local anesthesia.
Oh, this is the killer one.
Well, we're gonna help you out here, okay?
How soon will it start?
It takes about 5 minutes before it starts acting and about 10 minutes before it's at full activity, okay? Some women just feel the urge to push, they just gotta move. And if that's the case, we'll deliver. If not,
I feel the urge to have a lot of pain medication. Okay, push my butt.
Right.
And you'll get
got
the
it.
poop as it comes out.
Yeah. Probably right now feeling sort of an irresistible urge to push.
No, I'm feeling pain. Oh.
As Christina's contractions get stronger, the birth of her baby comes closer. The lung maturity test on Alicia Bauer's twins indicates they are healthy enough to deliver.
So I need to know if I'm going to feel it, because if I am, I need to calm down.
We're going to warn you when you feel a little pinch. There's one part where it feels like a pinch on your skin, and we'll tell you when that's going to happen.
Alicia is hoping she'll deliver her twins naturally. But the babies are still doing somersaults, which could make a vaginal delivery too dangerous.
Not at all. Feels good.
And these girls, we just didn't know. You'd scan them once, their head would be down. You'd scan them the next time, their butt would be down. So they were just on this little carousel. And they just kept changing horses on the carousel.
Ow!
Where did you feel that?
I don't know. It's in my left side.
As long as that first baby is coming out head down, then we can go ahead and deliver naturally. But if the first baby is coming out breech, then we have to do a C-section.
You're all done. Okay.
All right.
Yeah. We're going to get you lying down now.
Yeah. I'm trying to set them up on a double bacon here. Follow her like a 3 and a 4.
Alicia's situation is complicated by the fact that one of her twins probably has a club foot.
It occurs at about 1 to 2 kids per 1,000. Predominance in boys, about 70% of boys over girls. It's the most common congenital abnormality of the lower extremities.
Doctors won't know how bad the club foot is until after the twins are born. Gwinnett and Corey can't yet hold their new baby daughter.
Look at that hair.
Baby Brianna is stuck with tubes, and her intestines are wrapped in a plastic bag, ready for surgery.
Got mama's toe. We left it right in the family, didn't we, girl?
Her condition is good. It looks like a typical gastroschisis. The bowel looks pink and healthy, which is important. It doesn't look twisted, but it looked pretty healthy.
Long fingers.
But they have no idea what other problems they'll find once they get into surgery.
You're like
Okay, let's just get this baby out.
Yeah.
Oh, I can't see. I can't see my baby coming out. Yeah, okay, good. That's good.
And push. 2, 3,
Scoot over.
4, 5, 6, 7, 8, 9, 10.
Okay.
I feel a lot of pressure in my face. Is that okay?
Well, you know, pilots have to learn how to do the same thing so they can pull G.
Yeah, I know.
That M2 anti-G maneuver.
Do they try to poop out their butt when they push?
Well, I'm sure a few of them have,
Okay.
you know.
And again. And push. 2, 3, 4, 5, 6, 7, 8, 9, 10.
That was an excellent set of pushes.
It hurts a lot. It hurts a lot. We gotta get him out.
And you're probably feeling that irresistible urge to push.
Why is it taking so long?
You know, each one of these kids decides on their own scale.
Get him out. Pull that leg back, Dave. Push. 2, 3, 4, 5, 6, 7, 8, 9, 10. Keep it up, Chris. Keep it up. Keep it up. Good. 2, 3, 4.
I can, but it's...
You want to feel your baby's head?
No, I just want him out.
Okay. Well, I gotta get those
Get
boogers.
out of the way. Good.
Those boogers out.
Oh, my baby.
Yeah. Listen to you. Oh my goodness. Okay. I'm gonna hand this to you. Hard cut. Hard cut.
I can't believe it.
Look at that. There's your boy.
Oh, my baby.
You can touch him. Now I'm gonna hand him to Dr. Tate.
Oh, he's so beautiful. He's so cute. Oh, my baby. Cute. Oh, my baby.
Very relieved and happy.
Oh, baby, go with mommy. Right. You know what, Davy? Aren't you glad we harassed the hell out of the doctors the last 8 months? Look what it resulted in. Wonderful baby.
Tiny Brianna Scott is less than 3 hours old and already facing major surgery to put her intestines and colon back inside her body.
We're not sure if we're going to be able to do that all at once. Sometimes there's just not enough room for that intestine, and it puts an awful lot of pressure on both the bowel and the diaphragm, the breathing muscle, and the circulation in that area. And if you put it in and it's too tight, then that can hurt the baby.
But just as the surgeons begin, they discover an unexpected problem.
Eric, you may have a perforation here. She's got a perf bowel, look at that.
She certainly does. Sure does.
She's got leaking meconium all over the place. Unfortunately, she has a little hole in her upper small intestine, right here, through which all this green meconium is coming out. I think it's her small bowel. We're going to try to fix that.
The meconium, or fecal matter, has contaminated the operating field, forcing the doctors to re-scrub.
Well, this is an unusual problem. You have this hole in the bowel and leaking intestinal content all over our field, and so the problem is that we can't really prep the sterilely prepare and drape the baby out very well with that leak going on. So we're going to go ahead and close the hole in the intestine to stop this leakage. The bowel seems soft and pliable enough to do that, so the repair should hold up. And then we'll go ahead and re-prep the baby and start where we would have started. We have the baby on antibiotics, of course. Technically speaking, the intestinal contents are still sterile at this point early in life, but we still go through all these maneuvers to assume that there's bacteria present. So what we're doing is just trimming off the edges here so that it's fresh edges to sew, help it to heal better.
Once the hole is closed,
just about have the stomach repaired here.
The doctors can get back to the real challenge.
So now we have our repaired stomach.
Finding a way to fit the baby's bowels back in her belly.
That takes care of that part. Let's have a little saline. We're going to wash this off a little bit and prep it. We'll take it on down the drapes.
Alicia Bowers is about to deliver her twins via C-section. One of the babies is still breech, so a vaginal delivery would be too dangerous.
About that, I see an arm. Just move around. She's got big old broad shoulders. Hey, happy birthday, Ashley. Okay, we're waiting for baby B. Now we gotta go see what direction she's heading. She comes in, where's my sister? I see lips, I see an ear, lots of hair. Even more hair. More hair.
Hey guys, congratulations.
How you doing, Dad?
Between the two yellow. Between the two yellow.
Oh, yeah. Okay.
It's kind of dewy. It's fine.
Same thing. No fingers, no toes.
There we go.
As Alicia's doctors suspected, the twin named Hope was born with a severe case of bilateral club feet.
Once the child is delivered, treatment is really 2 stages. First is casting, where we cast the feet to try to bring them back towards the midline.
Just let me sleep.
The other possibility is sometimes that casting alone isn't enough to correct the anatomic deformity.
She's wonderful. Look at her.
And kids actually need surgical correction by a pediatric orthopedist.
When I saw her feet, I was surprised they were worse than I had imagined them to be. And then after that, it was like, okay, you know, we're gonna deal with it, and it could be worse.
The next morning, Navy Lieutenant Julie Traynor and her new baby, Connor, are doing fine.
I feel great today, and the baby's doing incredibly well.
After the events of September 11th, a brand new baby brings happiness back into their lives.
We're really excited. beautiful, healthy boy, no problems whatsoever. Came through the last 3 days with no problems at all, and we're excited to get him and show him to the world.
Happy that he's healthy, and looking forward to the next 18 years and when we could say goodbye. Bye-bye.
You guys take care.
He's got a little bit of bruising from the forceps.
Nicole and Paul are no longer a young married couple. They are a family.
It's just overwhelming, you know, the idea of being pregnant. You get, yeah, I'm pregnant, but now I have this child that depends on us for everything. It's overwhelming, but at the same time, it's awesome.
I can feel my face just lighting up. I mean, it was amazing. I could never have imagined what it would feel like.
The Trotts and their baby son, Kyle, will soon start a new life in Japan, where Nicole, an Army sergeant, has been assigned to duty. Baby Brianna has been in surgery for 2 hours.
We're going to use some sponge sticks on that too. I don't want to take that off just yet.
The pediatric surgical team is at the most critical stage of the procedure.
Okay, across the bottom there.
Before the surgeons can repair baby Brianna's abdomen,
Just marking where the tip of the catheter should go and stuff.
they have to cut an incision beneath her chin.
We're covering up the intestine to keep that all out of the way.
And run a tube under her skin and out near her heart.
Okay, you see the IJ right there? Yeah, that's to give the baby intravenous nutrition because the intestines are not going to work typically for 2 to 3 weeks in this condition. Go ahead. They need a reliable IV. When babies are so small, it's hard to get the IVs in the hands or feet to last more than a few days. And it also limits you in terms of the amount and type of fluids you can give and type of nutrition and things. So we're going to put a more durable IV in. Stitches to help hold this in, keep from being pulled out, which can happen. And this will heal up very nicely in these little babies. For some reason, fetuses heal without scarring, and this is not a fetus anymore, but nevertheless, these little babies heal remarkably well without scarring much at all, and we don't really understand how they do that. If we could figure that out, it would be quite an advance in medicine. The Broviac is in, completed. All you have to do is plug into that, release the clamp, and they can draw blood or give anything they need to the baby intravenously.
Okay, now we can go to work. Now the real operation begins.
Dr. Coleman, our anesthesiologist, has got the baby completely paralyzed and relaxed so that the muscles will not be tense and work against us. So what we're doing now is we're gently stretching the muscles of the abdominal wall to try to make as much room as possible. Let me just grab the umbilicus here. So we're going to start pushing in what we can. We haven't made any incisions or anything. Sometimes this whole intestinal system can get inside without any problem. So you don't want to make an incision if you don't have to. But we may indeed have to make an incision to attach a silo.
A silo is a device that would hold the baby's bowels and slowly push them back into the abdominal cavity as the baby's growth makes more room.
So as you can see, he's already successfully gotten a fair amount of intestine inside. So far, so good, but we got a ways to go yet. Yeah, try that.
Bit by bit, baby Brianna's surgeons are fitting her bowels back inside her abdominal cavity.
Looks like they're all going to fit, which is wonderful. Okay. So that's very nice for the baby. Yeah, isn't that something? Sometimes it just all goes in there and no problem at all. The baby doesn't look too tense either, so this baby's going to do very well. The bowel will probably return function fairly quickly because, yeah, just going to cut that off. It's not very inflamed. We're going to leave the stump of the belly of the umbilical cord in place. Some people cut it off and try to make a new belly button. Other people leave it on. I was trained to leave it or to take it off, but I think in this case, such an easy closure, we'll just leave it. Let's work on this fascia again. Let's have an Adson, please.
The final surgical task is to adjust the belly button.
I'm going to do a little modification here before we break. I'm going to move the belly button over just a little bit. I realized it was this far off center. Hemostat? Mosquito? And this will slough off and form a good-looking belly button, just like any newborn's umbilical cord. And that's more in the center, so I think that's a little nicer. Okay, let's go say hi to Mom.
We'll be right back.
All right, everything went really well. She did fine.
For the first time since she was 4 months pregnant, Glenette can stop worrying about her infant daughter's life.
And she seemed to tolerate everything very well. We didn't have any bleeding or any complications. Very smooth ride for her, so we're very optimistic about things.
He loves you, Dina.
For Christina and David Elsesser, the long nightmare is over.
What do you see, David?
Instead of another stillbirth, they have a healthy baby boy.
Congratulations. Thank you so much. This is
how cute.
little Davy. He was just eating. I can't thank you guys enough. I mean, it was just amazing. Everything. Dr. Sightley, Dr. Macedonia, all the staff. I can't thank you enough.
You did terrific.
It was
and what a beautiful baby, too.
And
it's all worthwhile, huh?
It was.
I've been here 5 days.
Oh, can you say hello?
Almost to the T. And look what we got.
Alicia Bowers is a proud new mom.
Look, there's her feet.
But the challenge now will be to correct baby Hope's bilateral club feet.
Feet.
Casting usually should happen within the first week of life. Kids have a pretty good outcome with casting and/or surgery if it's necessary.
Can we close her up?
Uh-oh. Uh-oh.
I'm up for it. I'm game. I'm glad they're our last children, not our first, because I'd be in for a big culture shock. At least now I have some experience. That's a big help.
Michelle.
Plus, they're so good. They're so quiet. They're my daughters. That's all I care about. They're breathing, their hearts work. Hey, that's all I care about.
After a delicate 3-hour surgery, baby Brianna's first visitors are her parents.
She's tiny. Yeah, I got big feet. They said I'd probably get to hold her tomorrow. Might be tonight, depend on her.
In about 2 weeks, when Brianna is taken off the feeding tubes, she'll be able to take breast milk.
They said it should be just a one-time thing. They put it back in, get it working. She should be fine. No life-term complications or anything. So she should be good.
Brianna will remain in the NICU for at least 2 more weeks. But she is already among a special group of babies and mothers who have made it through a special delivery.